It's quite clear that during the COVID pandemic that the number of cancer referrals that we've had has dropped quite significantly. At one point there were 30% less referrals into our health board than they were compared to normal.
Because of COVID, people are less inclined to come into hospital, presumably because they're fearful about coming into hospital. But this is exactly what you mustn't do.
COVID's not going anywhere, but nor is cancer, and there is no reason whatsoever to delay any consent.
If we catch it early, it means that we can treat it, and actually in a lot of cases we can get cure. If, for example, a woman has a cancer of the lining of the womb, if we catch it early and treat it early, then those women have a 98% cure rate. So I would urge you, if you are in a position where you've got funny bleeding or abnormal bleeding or bloating or pain, then please go and see your GP.
There's a lot of concern about COVID and what the prevalence is in our hospitals and whether indeed you can catch it if you come in to have investigations. You shouldn't be concerned about that. You must go to your GP because really cancer won't wait.
Throughout the pandemic, we've worked extremely hard to keep our patients safe, so we follow all appropriate precautions in our clinics. Staff have started to undergo twice weekly lateral flow testing for COVID to ensure that we're not unwittingly passing on COVID to our patients.
Everybody who comes through who has an operation is pre-screened, the staff are screened, and actually we have separate wards now, so we have green wards where patients come in where there are no COVID patients on those wards, so that patients are separated.
At least 85% of our staff, of our workforce in these hospitals have had their vaccinations, and so we have been very clear and very robust with our techniques to make sure that patients who come in for investigations and for treatment do not get COVID.
People have also been worried that they might not be able to bring their relatives or friends with them, and where it's been safe to do so, we've been letting people bring their relatives or friends with them to accompany them at a difficult time when they're going through a difficult diagnosis and treatment. The other thing I would say is that 9 out of 10 of the ladies who come to see me in clinic don't have breast cancer, and so they've had a long time of worrying about their symptoms, and it's a pleasure to be able to reassure them, and so don't delay coming to see us because that reassurance is worth its weight in gold.
If you've got symptoms, or if your mum's got symptoms, or your dad's got symptoms, go and see a GP, encourage your relatives to go and see the GP. It's really important. We are open for business. Cancer will not wait.
Go see your GP, get your referral to us, and let us help you to sort things out.
Cancer won't wait. Help us to help you.